Hi, my name's Shelby and I'm going to be your student physical therapist for the day.
The goals of long-term positioning are safety, comfort, and prevention. The goal of safety includes making sure that the patient is in a position where they are not able to fall. This can be ensured by laying supine, having pillows as barriers, and having the handrail up on the bed at any time the patient is in the bed. This is the most important goal when it comes to positioning a patient. The goal that is a close second to safety is comfort. It's important that the patient is comfortable before left alone so that they do not put themselves at risk to attain a more comfortable position. Placing a patient in a comfortable position that maintains the patient's normal spinal curves is essential to keeping them from compromising their spine, joints, as well as increasing their pain. The final goal is prevention. Positioning the patient and any extra devices such as a pillow or a towel are important to reduce the chance of sustaining a pressure injury, edema, or contractures. When leaving the patient alone, it is important to ensure that they are in a position where they are safe and have a call bell within arm's reach, the patient is comfortable, and that they are not in any position that may lead to any further injuries.
When we're positioning a patient for the long term, we need to place pillows under the areas where a pressure injury is most likely to occur. For supine, the areas include the head, arms, and heels. For prone, that is also the head, the abdomen, and then the toes.
First, we're going to be placing a pillow underneath the patient's head to reduce pressure injuries and for patient comfort. Then we're going to move to putting pillows underneath the arms. This allows the scapula and elbows to be elevated off the bed to reduce pressure injuries. Then we're going to move to the calf. We're going to place a pillow underneath the calf to allow for the legs to be extended and the heels to come off the bed. Here are just a few supine contraindications. First, we're going to be placing a pillow underneath the patient's head, allowing their arms to either be at their side or above their head. Next, a pillow underneath the hips allows for the reduction of hip contractures. Then, underneath the shins, it allows for the reduction of pressure injuries to the foot and the toe.
Since prone is our least common way to position the patient in long term, there's a position called 3/4 prone. That is between prone and side lying. So when we position for 3/4 prone, we're going to place a pillow under the patient's head, the patient's abdomen, the patient's legs. Bend your right leg for me. Thank you. And then behind their back to prevent them from rolling backwards.
Here are some contraindications for laying in prone.